My name is Karezeki. I'm the Executive Director of the Non-Communicable Diseases Alliance of Kenya. We are the national umbrella body of different organizations working in the area of non-communicable diseases, both prevention, treatment, rehabilitation, survivorship, and so forth. Non-communicable diseases, these are diseases that you are not transmitted from one person to another. They include conditions like sickle cell disease, diabetes, cancer, and other cardiovascular diseases, mental health. So there are multiple NCDs. Today we are here in Kisii commemorating the World Sickle Cell Day, which is being observed globally on the 19th of June every year. And this year we are here in Kisii to commemorate this day. As you know, sickle cell disease is a genetically transmitted disease and basically inherited from parents. And really, this is a condition children are born with if both parents are carriers. And this is a condition that the children will live with for the rest of their lives. And that is common with most non-communicable diseases. So in terms of the challenges that we face with sickle cell disease, it's a lack of awareness in the community. I think many of you know that sickle cell disease is endemic to certain counties in Kenya, in Western and Nyanza provinces, as well as the coastal region. At the moment, we are implementing programs in 17 sickle cell endemic counties. So basically, in terms of awareness, because people do not understand why sickle cell disease happens and why children are born with sickle cell disease, there's a lot of misconception about how this disease is transmitted. And generally, most people will ascribe it to witchcraft or curses or other areas. So you'll find that families which have children with sickle cell disease or individuals living with sickle cell disease are really stigmatized and ostracized in their communities. Previously, because of the lack of treatment and the lack of care, many children born with sickle cell disease did not survive to adulthood. But today, it is possible, and we do have children who are born with sickle cell disease who are now in their 20s, in their 30s, and even in their 50s and 60s. So it is possible to live a full life with sickle cell disease if one is able to access diagnosis early and be enrolled on treatment and care. So it is no longer a disease where children will die early, but the issue is we need to provide, one, the diagnosis, and two, ensure that these children get treatment and care. So basically what the NCD Alliance of Kenya is doing, working together with the Ministry of Health, we're implementing two projects. One is Afya Thabiti, which is being implemented in the 17 sickle cell endemic counties, including Kisii, and the other is Pen Plus. So these two projects, which are being implemented at the moment, are basically focusing on sickle cell disease in addition to other NCDs. So the Afya Thabiti project, implemented by NCD Alliance in partnership with the Ministry of Health and AMPATH from Moi Teaching and Referral Hospital, is focusing on the 17 sickle cell endemic counties, including Kisii. And this is a project which is focusing on, one, capacity building of middle-level healthcare providers for them to understand what is sickle cell disease, how is it diagnosed, and how should it be treated. In addition to capacity building in terms of educating healthcare providers, they'll also be working with community health workers for them to understand about sickle cell disease and therefore to be able to spread the message of sickle cell disease in these 17 sickle cell endemic counties. For people to understand that sickle cell disease is not a curse, it is not witchcraft, it is a disease which has a biological origin, and it is a disease which can be treated, and the children can survive so long as they are diagnosed early and they are put on treatment. In addition to this, there will be a program on newborn screening because, as I mentioned, because sickle cell disease is a genetically transmitted disease, it is possible to actually screen the parents and screen the children as newborns to find out if they're actually either carriers or they have this or they actually have sickle cell disease. And this way, these children will be able to start treatment and care immediately they are born. So this is a new way of ensuring that treatment have access to treatment and care right from the beginning of their life. And if it is possible to do this, it means that these children will not grow up with the complications of sickle cell disease. One of the other areas that this project will be looking at is premarital counseling. As I've mentioned, sickle cell disease is transmitted genetically. So basically, it is possible to counsel people intending to get married or people intending to get children to find out if they are carriers. If you're a carrier, marrying a carrier, then the chances of you getting a child with sickle cell disease are very high. So one of the things that the program is going to be doing is advocating for premarital counseling for people to understand whether or not they are carrying the disease and therefore make an informed decisions about either getting married or getting children. Of course, this is an individual choice, but it is important for one to understand how this disease is transmitted and, if possible, how you can prevent your children that you have getting sickle cell disease. So those are two areas that this particular program will be working on. In addition to this, NCD Alliance will be working with persons living with sickle cell disease, capacity building them on advocacy for them to one, to understand their condition, two, to understand the treatment and care and how they can self-manage themselves and what they need to look out for, and also public participation. How can they advocate to their county governments about the treatment and care that they require? It is important for the counties and even for the national government to invest in treatment and care for sickle cell disease and also in terms of preventing sickle cell disease. But who best to advocate but the people living with sickle cell disease themselves? So this is something that the NCD Alliance of Kenya will be doing. We're working with persons living with sickle cell disease, one, for them to understand their condition better, two, to capacity build them on skills on how to do advocacy, and also to understand like the public expenditure management cycle, in addition to their rights as people living with sickle cell disease and their rights as citizens of this country. It is the onus of the government to provide treatment and care for the citizens. NGOs and other partners are really supporting what the government should be doing. But at the end of the day, it is a government which is supposed to provide the treatment and the care that the citizens need, including people with sickle cell disease. And it's not just the treatment, issues of diagnosis. Because to know if you have sickle cell disease, you have to be screened, you have to undergo a diagnostic test for you to know whether or not you're living with sickle cell disease. So once you're diagnosed and put on treatment, you need to have regular monitoring of the treatment that you're receiving to see if it is working and to see whether or not the dose that you have been given is the correct dose for optimal outcomes. Again, it is important for the government to understand that yes, we need to provide the diagnosis, we need to provide the regular monitoring of the treatment that you're getting, but in addition to this, to ensure that hydroxyurea, which is the primary treatment, the optimal treatment for people living with sickle cell disease, is available in the public facilities at a cost that the people can afford. At the moment, hydroxyurea is firstly not regularly available in public facilities, and secondly, it is extremely expensive. So most families cannot even afford the treatment. So these are issues that persons living with sickle cell disease will be advocating for to the government in terms of one, diagnosis, in terms of access to treatment, access in terms of availability, access in terms of quality of treatment, access in terms of the cost of the treatment at a place that they can actually access in terms of geographical access. So that is Afya Thabiti project that we're working on. In addition to this, we have another project which we are implementing in Vihiga County at Hamisi Sub-County facility called Pen Plus. It is also being implemented in Isiolo, although Isiolo is not a sickle cell endemic county. But essentially this particular project is looking at non-communicable diseases which primarily affect children, and especially children in vulnerable situations. As you're well aware, most of the children living with sickle cell disease in Kisii and Nyanza province and the western region come from very humble backgrounds. And this is why this issue of treatment and care is most important, and why it is important to provide this treatment and these medicines at a cost that the families can afford. I mean, are you going to buy food for your children? Are you going to buy hydroxyurea? Are you going to the diagnostic tests? These are some of the challenges that families are facing, especially in today. We all know the cost of everything has gone up, the cost of medicines have gone up, the cost of transportation has also gone up. So, in addition, coming now to the Pen Plus project, looking at conditions like sickle cell disease in children, type 1 diabetes, rheumatic heart disease, congenital heart disease, and severe asthma. These are primarily conditions which affect young children, and these are lifelong conditions. Imagine being diagnosed with sickle cell disease as an infant. You're going to live with sickle cell disease for the rest of your life. So you need to be able to access treatment and care at a cost that, one, is accessible to you, and it's also affordable to your family. And really, if you do have these conditions, they should not compromise your education. They should not compromise your opportunity to live to adulthood and to actually contribute to nation building and also have a career. So basically what Pen Plus is doing is focusing on sickle cell disease in addition to type 1 diabetes and these other conditions which primarily affect children, especially children in vulnerable situations. Firstly, by developing a model clinic. We trained the healthcare providers, again, working with clinical officers and nurses, and also pharmaceutical technologists, nutritionists, and laboratory technologists, for them to understand these conditions. How are they diagnosed? How should these conditions be treated? And how can we provide optimal care to these children so that they have a chance of growing up to be teenagers, to be young adults, and to also contribute to the economy, as I've said. So at Hamisi Sub-County Hospital in Vihiga County, we have established a model clinic which is actually providing treatment and care for sickle cell disease, type 1 diabetes, rheumatic heart disease, congenital heart disease, and asthma for children living in the vicinity. At the moment, we're getting children from the surrounding counties, from Kakamega, even Bungoma, from Siaya, some are coming from Kisumu. We're able to provide the diagnosis and the treatment that these children require at no cost to the children themselves. We're also we've had a sustainable supply of hydroxyurea in the clinic, and this has actually drawn a large number of families from the surrounding areas to access this optimal treatment for sickle cell disease. In addition to this, we have point-of-care tests which enable us to diagnose people, to screen persons living with sickle cell disease or thought to have sickle cell disease. And we're also arranged for confirmatory tests. We're working with Moi Teaching and Referral Hospital, who are able to provide the confirmatory tests for sickle cell disease. So essentially what we're trying to do is to provide a model for optimal treatment and care for sickle cell disease and these other childhood diseases. So in addition, it is important to know that sickle cell disease and these other childhood diseases, there's an issue of diagnosis, there's an issue of the medicines that is required, but there's an issue of educating the families and the persons living with these conditions of how to better manage themselves. Imagine you're living with a condition for the rest of your life. You don't need to go to the hospital every day, but you definitely need to go on a regular basis to be monitored. But how can we teach you how to manage yourself? So this is a key component of these programs that we are running, to educate the families, the parents, the caregivers, and even the children on how to better manage their conditions. 1, understand your condition. 2, understand what are the important things you need to look out for. What are the danger signs that mean that you need to go at once to the hospital? In addition, issues of physical activity, issues of nutrition, the diet that you eat is very key, especially for sickle cell disease.